Well, hello everyone. My name is Karen Turner and I am an Education Outreach Coordinator with Medical Advocacy and Outreach. My office is located in Montgomery, Alabama. We have 2 additional brick and mortar spaces, one in Atmore, Alabama and one in Dothan, Alabama. We have a couple of commonly asked questions about sexual health, STDs and STIs. So we're going to get started. It says, what is the difference between an STD and an STI? Okay, so STD stands for sexually transmitted disease and STI stands for sexually transmitted infection. Some STIs, sexually transmitted infections, if left untreated, can turn into a sexually transmitted disease. However, one of the more trending answers to this question has to do with stigma. So if someone is referred to as having a disease, it kind of comes off as derogatory or something that can't be treated or something that is lifelong, that they can't get rid of. So do keep in mind that all infections do not turn into diseases. But all right, so let's see what question we have here. Question number 2 says, how do you contract HIV? All right, so there are several ways that you can contract HIV. One is, of course, through sex, and you can, mother can transmit HIV to her baby through delivery or breastfeeding. However, if the mom gets her prenatal care early in the game and gets with the provider, they definitely can make sure that she has a normal, healthy baby. Also, too, by sharing needles for recreational drug use. Some ways that you cannot contract HIV is, we hear this all the time. Can you get it from a toilet seat? No, you can't get HIV from a toilet seat. No, you can't get HIV from swimming in a pool with someone who's HIV positive. And nor can you get HIV from mosquitoes. And our next question for today is, oh, I love this question here. It says, how often should you be tested for HIV? All right, so the CDC, which is the Centers for Disease Control, says that anyone suggests and recommends that anyone between the age of 13 to 64 that is having sex or has had sex should be tested for HIV. You should be tested for HIV according to your sexual lifestyle. So each individual person is aware of what they do and who they do it with sexually. Number 4. It says, what are common STD symptoms? So some common STDs would be gonorrhea, chlamydia, trichomoniasis, syphilis, herpes. So the symptoms could vary. However, some of the more common symptoms may be a vaginal or penile discharge, discomfort when urinating. Also, it could be some itching in the genital areas, some pain or bloating, just a feeling of discomfort in your genital area. And we don't want to forget about oral STDs, such as gonorrhea or chlamydia or syphilis, which could show itself as like a sore throat that lasts for a while. There could be some it may appear to be like strep throat, some white mucousy looking in the back of the throat, or swollen lymph nodes. So when you're thinking about common symptoms, you want to think about symptoms that may be oral and or symptoms that may present in the genital area as well. All right, let's see. This question says, what is the difference between HIV and AIDS? That is a very good question. HIV and AIDS are not the same thing. HIV stands for human immunodeficiency virus, and AIDS stands for acquired immunodeficiency syndrome. HIV is the virus that causes AIDS. I actually just learned something new not long ago, which I thought it was a really good way of putting this. So I would often tell people that a person who is HIV positive, they can acquire AIDS if their CD4 count starts to fall below a certain number. And that's kind of like when the body's immune system just really starts breaking down and says, hey, I'm getting weak, I really can't fight for you like I used to. HIV happens in 3 stages. There's acute HIV, and then some people may refer to the second term as chronic or kind of latent. That's when you have the virus, but it's being managed or treated. If it's left untreated and you're not caring for yourself and following the directions of your provider, it can turn into AIDS. Now, AIDS is no longer a death sentence, and just because your CD4 count falls below that number does not mean that you can't get it back up. It just depends on each individual person. Question for the day, and it says, what does it mean if someone has HIV but they are not showing symptoms? All right, so once a person is exposed and they begin to show symptoms, that is called acute HIV. That's kind of like in the first stage of it, and these symptoms may present like flu or respiratory issues. They may experience like fever, feeling tired, fatigue, lethargic. Some people may break out into a rash. It just depends. A little reddening of the eyes, different things like that, swollen lymph nodes. The symptoms can last maybe up to 14 days, sometimes a little bit longer, sometimes not as long. It just depends on the person. So once this little stage has passed, that person may start feeling fine, but it does not mean that the virus has gone away. They're just not presenting any active symptoms at the time, or it may be mild symptoms such as I'm feeling tired. The only way for someone to know if they are HIV positive is to get a test. It's been great to be here today. It is an awesome opportunity to partner with Trojan Outreach on the Troy University campus in Troy, Alabama. When we think about college-age students, they are one of our primary target populations. I use the term that college students are kind of like in the danger zone when we look at STDs and STIs, college life.